Thank you so much, Logan. And thank you, Jill, for organizing this beautiful gathering. So nice to see all of you and all of the familiar faces and names. My name is Asya Gunduz, she, her pronouns. I work at the OEHR as lead for trans and gender diverse HIV prevention and health promotion. I am also the co-lead of TUVERO, the Trans and Gender Diverse People HIV and STBDI Research Initiative. And I'm working together with the team of Ashley, Angela, and Mona. So happy to be here. I'm also doing um, so I'm coming from a community activist background and also researcher. I'm currently doing my PhD studies in gender studies at York University. I'm also an MA holder at the University of Gothenburg from Sweden in gender studies as well. Um, Currently, I'm mostly doing the research facilitation more than research itself. And also, um, my um, kind of like work is grounded in HIV field work. I've in the field of work of HIV clinics and also sexual health campaigns as well, both in Sweden and in Canada. I'm also at the board of Maggie's. I'm mostly doing the mitigation stuff for them and also working as a sex worker as well. So happy to be here. So also really excited to hear everyone's perspectives. Thank you so much.
Amazing. Thank you, Asya, and thank you, Logan and Jill, for organizing and facilitating. I'm so excited to be here. No worries, Logan, about those citywide grand rounds. They're going to be posted on the TWERE website, so everybody will have access to them, including the slides and speaker notes. I presented on the women-centered HIV care model and how it was applicable to trans women and gender diverse folks. And it's really an honor to be able to speak with folks this week and engage in these deep conversations on the precipice of Pride Month, which starts tomorrow. So happy Pride to everyone. My name is Ashley Lacombe-Duncan. I use she and her pronouns. I'm also calling in from Toronto, covered by Treaty 13 with the Mississaugas of the Credit. And thank you, Logan, for the beautiful and meaningful acknowledgement of ongoing colonialism and racism impacting the communities that we work with and care deeply about. I'm a faculty member at the University of Michigan at the School of Social Work, as well as an adjunct scientist at Women's College Hospital, where I've really had the honor and privilege of, I guess just over a decade now, of conducting community-based participatory research focused primarily on access to healthcare and health equity among LGBTQ folks, and particularly trans and gender diverse people living with and affected by HIV. So I'm very happy to do this work with TWERE, and I know we're going to dig more into our work. So I'm going to stop here for now. But again, thank you for inviting us.
Great, thanks so much. And I just warn everybody that I work with two monitors. So sometimes if it looks like I'm fully distracted, it's because I'm looking at the Zoom screen instead of looking at a couple of my speaking notes, but I promise I'm fully present. Thank you for those introductions. I was, like I said, I was excited before, but I'm even more excited now to have this conversation today. For those who are joining, again, I think it's important to know that given the intention of these talks, the Women-Centered HIV Care Hub has opened up this audience, not just to the folks who identify as members of our group. So I just want to take a few seconds to quickly highlight again what the Women-Centered HIV Care Hub is, and then we will jump into our conversation today and what our objectives are. So the Women-Centered HIV Care Hub is funded by CIHR, and I really want to stress that our intention in this hub is to develop a network, so not just to engage folks who are already doing work in this field, but folks who want to do work in this field, folks who can complement the work that we're doing. You know, each of us brings expertise, but we want to do really big work. And so the more folks we can get into this network with different expertise, different wisdom, different ways of challenging our thinking, the better. So it's a network of like-minded women, and that's really intended as inclusive. So cis and trans women and two-spirit and gender diverse people and allies that are really focused on using intersectional feminism, anti-racism, anti-oppression, community-based, and trauma-informed practices for three main goals. The first is to support each other in our work, which, you know, Ashley, you're talking about how you've been involved with our team for 10 years. I've been here, I think, almost 13 years. And that's what's kept us here. We want to keep that growing, this idea of supporting each other in our work. The next is to really help train the next generation of people who want to do this work. And with the Women-Centered HIV Care Hub, we've brought in how CIHR envisioned that. And we're really focusing on the future of HIV research with and for women as an inclusive space for anyone who wants to lead research, whether that's within academic environments or importantly, community settings. And the last is to work together to carry out knowledge mobilization on the women-centered HIV care model, but also related models, associated frameworks, and topics that really aim to push the envelope on health equity and social justice, particularly in ways that will impact and improve the lives of women living with and at risk of HIV. People who know me know that research to sit on a shelf is not desirable. And so after 13 years of working with this team, it's so exciting to be at a time not only that we can position ourselves as a knowledge mobilization group, but that the funders finally see that we need really robust and ongoing funding, not just, you know, a little percentage of the grants that we're given to really mobilize this work that we're doing. If you're not already a Hub member, please feel free to reach out and let us know. We have a listserv, we have materials on Basecamp that Jill is doing an amazing job of for the next, 27 days for those who don't know. And then it'll be me for an interim while we look for the next person to help keep us on our toes. So reach out to Jill if you want. Jill will put your email, or Jill can put her email in the chat, and we'll go from there to get you involved. So these chats are really, these talks are really about a discussion. So every month we've been inviting 2 guests with expertise in a specific area related to equity and health research. And we're going to ask them the same 3 questions. And we're going to ask them to talk about their perspectives, how they've operationalized or are trying to operationalize equity and health research, and what they think the next steps are to sort of advance this discussion. And so we've asked Ashley and Asya to do this together, given the work that they're doing as a team and as part of a team with TWERY. And I'm really excited to hear each of your thoughts on these 3 topics. So we're going to start with the first question. It looks like Mona had previously decided that Asya would answer first and then Ashley would follow up. Does that sound right to both of you? Okay, great. And so for those who haven't seen the question recently, the question is just, why is equity in health research important to you? So I'll turn it over to you, Asya.
Thank you so much. For me, the equity in health research is coming from a personal and community space, both as participant of a research interview or a design. First, I need to feel close to the research itself. And I need to feel close and safe enough to engage in research and the possible outcomes. There have been research engagement requests when I was doing community advocacy in Turkey and Canada that I felt being both, tokenized and utilized for only for recruitment goals. Or some of the researchers are coming and requesting help for recruitment without contextualizing their research for queer and trans community. This has been happening frequently on research areas that touch on both sexual and mental health. I think equity is a roadmap for a researcher in designing their research reasoning and methodology. And the dynamics of a research are not just in a vacuum or void of structural inequities. We already know that. And from the idea process to recruitment implementation, equity models make us see the patterns of power in designing the research. It's also a constant reminder for us, of self-reflection and self-positioning as a researcher, a constant process of balancing the power dynamics in research process.
Awesome. I would say, Asya, that first of all, I also love hearing you talk, but a lot of what I'm going to share echoes what you shared as well. So I have a really long-standing passion for health equity, growing up in a rural community and seeing loved ones go without access to primary and preventative care. Recognizing really early on that even in a country like Canada with supposed universal healthcare access, that a lot of folks don't have access to the care that they need and deserve. And then later coming out as a queer person and facing my own challenges, accessing particularly sexual and reproductive healthcare, even in a city like Toronto, that has a lot more LGBTQ specific resources than elsewhere, really solidified my interest in health equity research. But thinking specifically about what solidified my the importance of equity in health research and why that's important to me really stems from my social work background and some of my social work experiences. So a lot of this really resonates with what you shared, Asya. As a social worker, we're trained to understand our own identities, the privileges and power we hold, and our core values are really cornerstone to equity in health research, like respecting the inherent dignity and worth of all people, promoting individual and community self-determination and autonomy, upholding and advocating for human rights, ultimately like putting social justice at the forefront of everything that we do, valuing human relationships, so centering the well-being and interests of people in the work that we do, and then that continual ongoing self-awareness and self-reflection. And so pretty early on, I was able to see and put these values into practice as a social work intern at the Regent Park Community Health Center, where I was providing low barrier services primarily to women experiencing intersecting oppressions, whether that be classism, racism, transphobia, homophobia, substance use stigma, and sex work stigma. I supported peer-based programming and attended talks given by community members to health and social service providers. And these really early experiences demonstrated what meaningful community engagement and equity in health research looks like, the benefits to communities when their expertise is valued, put into action, and for which expertise is fairly compensated, and really the transformative power in relation to systemic change. So I would say that equity in health research is really just a way of being for me. There's no other way that I could engage as a social work researcher.
Thanks to you both. I hear the same message, right? There's no other way to be. That's like, it's just who we are. And I think that what's so neat about these talks is that's true for so many of us, but it's good to be reflective so that when we are involved in things like supporting futures, we have the language to talk about where this came from, right? Whether it's rooted in our lived experience. And even those of us who are in academic spaces doing this work may have lived experiences related to health equity. And so just like creating that sort of common experience is, I think it's really useful to reflect on it and make mental note of it. So then Ashley, do you want to tell us a little bit more about your work as it relates to health equity? And more so, I think, on how you've operationalized it or how you're trying to operationalize it. And then I'll come to you maybe after, Asya, just to divide things up in a way that'll be easy to follow.
Sure, happy to. I'm going to warn folks that this is my long answer that my wife gave me a critique on this morning, but I just decided that all the context is needed. So I'm going to start a little bit at the beginning, moving from the past in my first answer to the present in terms of what we're up to today. So as we mentioned, we co-lead TWERE alongside Mona and Angela, which was co-founded in 2017 by Dr. Mona Lutfi and Yasmin Persad. And our work is really grounded in principles of intersectional feminism and community-based participatory research, which means centering the perspectives and the leadership of trans and gender diverse communities in all aspects of the research, from determining like what we prioritize in our studies, how we conduct our studies, how they're carried out, how knowledge is shared, with whom, what the key messages are. And so what that looks like is ensuring trans and gender diverse folks are in leadership roles in TWERE, are hired as and fairly compensated as research assistants and coordinators, are part of all of our grants and participate on community advisory boards. So to give a little bit of a flavor, some of our studies have included developing and pilot testing and HIV and anti-trans stigma intervention with health and social service providers, collecting clinical chart review data to understand health and social care, and particularly gender affirming and HIV care disparities among trans women, looking at the applicability of the women-centered HIV care model to trans communities. And we're currently conducting a study to explore drug-drug interactions between feminizing hormone therapy and antiretroviral therapy. So that's really meant to just give a flavor of the work. But I think one thing that I love about the work that we do that I think really centers equity is taking this social ecological approach and really recognizing the ways in which cisnormativity and other systems of oppression operate in health research, and how stigma is enacted in laws, policies, organizational structures, and interpersonal relationships. So in that way, our work is really focused on changing structures and systems rather than focused on individual practices. Which we know historically that particularly in HIV research that's really risk focused, that bringing strengths-based perspectives and those that seek to really change systems is really critical. Another thing that I think that talking about the breadth of our work shows is the importance of flexibility and adaptability to go where community research priorities are. As a social work researcher, when we conceptualize the drug-drug interaction study, that stuff is way over my head, but I work in a team with really awesome folks who are really smart, who are really committed and dedicated, as I am, to getting the knowledge necessary for trans folks to be able to feel confident in their clinical care. And so we learn, we adapt, we put together teams that can address these critical questions. And so in that way, to me, it's never about me or about us, it's just where the community leads. So 2 specific examples of what it looks like in the day-to-day to operationalize, linking back to the value of self-reflexivity. One thing that's important to me is to recognize my own identities as a cisgender, white, able-bodied, queer person, and to only do work where my contributions are needed and wanted. So early on, when I was trying to decide what to focus on for my PhD, and I was meeting with Mona, she had identified some opportunities to look at the experiences of trans women in the Canadian HIV sexual and reproductive health cohort study. And so she had connected me with Yasmin, our amazing community partner and revered trans community activist who recently retired from TWIRI after 7 years to pursue her next adventures, and we miss her. But I started with meeting with Yasmin for coffee, and we chatted, we got to know each other. And in that very initial conversation, I raised the ways in which, trans communities had been harmed and exploited by cisgender researchers, particularly in HIV research in Canada. There's been some really excellent writings by trans community authors on that exploitation. And I asked something like, what do you think about us doing that work together? What do you think about cis folks conducting research focused on trans communities? And her response was one of practicality and affirmation, that we both have different skill sets and we're able to leverage different resources. And that working together just makes sense, which started the beginning of a beautiful working relationship and friendship. So I guess what I'm trying to say is to not shy away from those conversations about who we are and what we bring. And for researchers in particular to be both cognizant of historical and ongoing harms that are perpetuated by researchers with communities that we work with, and to be able to hear "you're not welcome here" explicitly or sometimes more subtly, and to be willing to walk away or to put in the work to build, if communities want to build relationships so that trust can be gained. And then just one other quick example I wanted to give was around the relationship piece. Operationalizing equity in health research means having relationships with the people we're working with and supporting everyone's goals and dreams. I love the people that I work with, and that's what sustains me I think it's what sustains all of us through our difficult work. But what that looks like is recognizing not everybody has the same access to resources. So I use my skills to support folks to be able to contribute meaningfully, whether that's hosting workshops and research or meeting more individually or one-on-one to talk about papers we're working on, for example. but it also means supporting folks' goals and aspirations outside of the research process. So, for example, sometimes the most important thing isn't what we're doing in research, but it's about getting a grant to fund work, direct service work with trans folks of color. And so how can I use my skills and the research we have to contribute to that grant? That's the most important piece at the time to get the services that folks actually need. Takes precedence. Sometimes it means stopping because you need to go to a march against some anti-trans bill that's happening at Queen's Park. So it means recognizing that we all have different things that we're going through, and we need to support each other and be there for the advocacy piece that's so critical. Ultimately, I'm talking about reciprocal relationships that are rooted in advocacy and recognition of that power. So that's really just a start in terms of like team dynamics. I have other examples related to recruitment and study procedures and data collection if we have time later, but I'm going to stop there. Sorry, Asya, that was so long.
Oh my God, no worries.
It was great. And
Please go on.
Asya will have time too, so not to worry. So Asya, Mona had in her notes that you're a PhD student.
That's correct.
I didn't know that. So that's so cool. So as a PhD student and as somebody who's in a policy, position in this field and working at the OHTN, what is your approach to equity in health research, or what sort of useful points on the topic could you share about how to take it up, how to make it happen?
Thank you. I think Ashley summarized like some of the kind of example or sample actions that one can take for collaboration in trans research. And I think I want to talk a little bit about how, like, one example, for example, that I have in mind that is a lesson for not to do things when designing research. When we talk about equity, we also emphasize the outcomes of health research for the community, and especially with research outcomes that aim to implement a health model. And I remember there's a trans man peer who's also a friend of mine who was telling how he was misunderstood as cis at the sexual health clinic, who was also doing a health promotion research on PrEP. So the clinic was doing the health promotion research, providing PrEP as part of research. So the recruitment for research only involved GB, MSM, and trans women. But since he was first assumed as cis gay man, they automatically included him in the program, promising to provide, free PrEP. But after it was understood he was a trans man, then they said we cannot provide it free anymore because it's not in the research mandate. On the research design that provides, that prioritizes health equity or equitable outcomes, this loophole in the recruitment would have been avoided, right? The equity model also would seek to include the provisional PrEP or other prevention methods for the specific case. Although they're not the research profile, and they would give, find ways to communicate the recruitment strategy better, rather than just like excluding the person or just saying, oh, okay, you don't count in the demographics profile. So what I'm getting to add is that, and what I'm also trying to achieve as with my PhD kind of vision, especially in the context of queer newcomers and sexual health, is that trans inclusion on an equity perspective also means to care about the exceptions, because we are the exceptions and irregularities to this Canadian and cis heteronormative system as trans people and newcomers, and also other equity seeking groups. So, and I can also give an example from my master research. My research was on the bereavement processes of trans women who lost a trans friend to a transphobic violence in Turkey. And my research design also included supporting trans people to navigate their loss inside and outside the healthcare system. So the research itself or research mandate was not about healthcare overall, but the outcomes of the research touched on the, how the participant would feel after an interview, or if they would need any resources. So I had kind of like a system that I did with them, such as like going with them to hospitals, mental health experts, suggesting them Turkish resources on grief, finding material resources on safety, etc. So the equity model helped me find trans-inclusive resources on healthcare delivery, although the core topic of my research is not about the healthcare. And most of my efforts, also what I do for the OHTN as well, includes kind of asking the right questions. I'm currently conducting an environmental scan for the region to see the intersections of HIV care and trans care. And I always kind of try to remember what areas need kind of outreach, and then, for example, listing Coban clinic in Eastern Ontario that only does the initiation of HRT. So what are the other ways that their members need to integrate their model with HIV care model, or with our model, women-centered HIV care. So I think some of the things I also try to remind myself is the questions of like who determines the priority, who has the access to evidence, who has the access to decision making. I think in any work we do, we need to consider these who questions. And sorry, in the initial stages of our research. So I determine my priorities, not only complying with job responsibilities, but also like see beyond the networking profiles. I strategize my lead to the regions where trans health and HIV cascade is not as accessible, or the ones that have less integrated care resources. And the Tuvera or TGD sub-hub collaboration is an amazing opportunity in that sense, because I'm currently in a kind of a bridge position between OHTN and Tuvera, building a bridge between two organizations in a way to become better informed on and finding a more effective balance between community and research needs. Yeah.
That's so, yeah, thank you so much. I always take little notes, and just the story you led with, which I learned so much through story, reminded me, like, if somebody wants to be in a study and they don't meet the criteria, we still have an ethical responsibility, right? Like, it meant that they wanted to access whatever was part of that study, right? And so that example is so clear to me, and it's such a good reminder as a researcher. Like, if somebody doesn't meet, particularly if they don't meet the inclusion and it's a study where they're accessing some kind of service, like Ashley said, the research is not always the priority, right? In that moment, the priority should, from an equity perspective, is why did this person want to be part of the study? And if I can't fix the loophole in the study, how can I better serve this person anyhow in this moment? So thank you for leading with story. I think story is so powerful.
Thank you so much. And also for the research designs as well, like we know that the resources on sex workers as well is not mostly focused on trans male sex workers. So it's kind of like, also as a researcher, knowing the context of, where a trans man is coming from.
That's right.
Or trans mass person is also important. It's that kind of like our resources and stuff. Yeah.
Yeah.
Sorry.
Yeah. No, don't be sorry. It's great. Thank you so much. That's why I love these talks. So we're at our last question, and our timing looks great. So both feel free to give your full answer that you prepared. There's no rush. So we're going to think about the future now. And it's good timing because there are exciting things happening for TWERI and for the TGD People Sub-Hub. So Ashley, what do you see as the next step for equity in health research in your work?
Awesome. It is such great timing. And Asya, thank you for mentioning also the TGD sub-hub. So I was actually I've prepared to drop the aims of our sub-hub into the chat for folks. If you're not already part of the trans and gender diverse people sub-hub through the Women-Centered HIV Care Hub team, we'd love for you to join us if what we're talking about today resonates with you. So really, our overarching goals are to support and advise the Women-Centered HIV Care Hub team on gender-inclusive and affirmative practices, particularly in the dissemination and implementation of the Women-Centered HIV Care model. So we really want to make sure that resources related to the Women-Centered HIV Care model include trans affirmation and aspects relevant to the experiences of trans folks. We're also focused on building networks of trust and relationships with researchers, clinicians, service providers, community members, and more who are trans and gender diverse or who serve trans and gender diverse folks in positive ways. To design and initiate knowledge translation and mobilization strategies, so specifically things like being here today. And of course, to advocate, that was really important to us as a sub-hub, that advocacy piece and action piece, particularly for gender-affirming care, and to build provider and organizational capacity. So two really exciting developments in our work. One is that we're focusing more broadly on gender-affirming healthcare, like access to gender-affirming hormone therapy and gender-affirming surgeries, and then the intersection of gender-affirming care and HIV and STBBI prevention and care, because we know that having those two types of care integrated increases uptake of HIV care in particular. And we also know that access to gender affirmation is a social determinant of health for trans folks. It can be critically important to, particularly medical gender affirmation can be critically important for many trans and gender diverse people, promoting health and well-being. And we want to make sure to work collaboratively to push back against regressive policies that limit access to gender-affirming healthcare that we've seen a lot of in the United States, but also emerging in Canada too. So as Asya mentioned, she's done some amazing work already, starting and work on this environmental scan in Ontario. TWIRI was recently funded by the Ontario HIV Treatment Network to build on that work by also conducting stakeholder interviews with folks. Particularly, we're looking at organizations that are providing HIV and STBBI care, organizations that are providing gender-affirming healthcare, and then looking at the capacity for spaces to provide both or to ramp up referral services. The second exciting development is that we're applying for a grant to do this work nationally and expand TWIRI across Canada, building a national network of community members, clinicians, researchers to support the mission and work. And this will enhance equity in health research by engaging this broader team, making new community connections. But as Asya mentioned, there are some really big gaps when it comes to understanding regional differences. We know that there are regional differences when it comes to access to all types of healthcare, but particularly gender-affirming care. So we're going to be able to recognize geographic differences across rural, suburban, and urban areas within provinces, but also to be able to look at differences across provinces and trans-specific service availability, which will hopefully redress some historical and present day inequities when it comes to trans health research being focused predominantly in rural areas, and build capacity for community-based research in HIV and STBBIs with trans and gender diverse communities in underrepresented provinces and territories. So another really important piece moving forward is that knowledge translation and exchange piece, including reaching out to community organizations to develop presentations that could be helpful, making sure our work is widely shared. So for example, our presentations are being posted on our TWIRI website, so you can check out all of the recordings from our third annual TWIRI conference that we hosted last fall. And as well, we'll continue to post, for example, this talk and other talks that we do so that they're widely publicly accessible. So really in some of the next steps for equity and health research are really focused on that broad integration with the really important piece of gender-affirming healthcare, building a national network, and working on enhancing strategies to integrate research findings into community practice.
Thank you so much. So Asya, you get the last word or the last question. What do you think the next steps are then, from your perspective for health, for equity in health research in your work? You can even sort of say it as a call to action for the audience. But again, really just what do you think the next steps are for equity in health research?
I think the next steps for me is to, standardize my research and reporting endeavors to improve equivalence. And this will happen through asking the good questions. And actually, I need to kind of reference Dr. Isaac Lugina. Um, like these are like his words, these questions from his work on the presentation at the car. And so this will happen asking those questions and also for the researchers on and also monitoring the outcomes of the research. One example for this is our efforts at the OHTN as well, that is expanding its operations for different equity-seeking groups and priority population networks, as well as the overlooked locations in the region to reach the 95, 95, 95 UN targets. And also lastly, it's a very humbling question. So I would like to come back to my point on trans people, especially racialized trans people, being the irregularities and exceptions of the system. I think we need to remind ourselves as the designers of the research, we operate in a cis-heteronormative ancestral colonial system, which affect not only the contents of our methodology, but also recruitment portfolios, but also the epistemology of what we call as what is a design, as being this fixed, non-dynamic, kind of unvarying slate. So my humble call to action for researchers will be to operationalize the exceptions and irregularities in the implementation of research for the sake of uplifting the community members and growing the community benefit of the research. We need to be asking questions of what or who can we miss out or overlook in implementation? Who are we excluding for the sake of research methods? What strategies should we implement to make the research most impactful and inclusive for the community members? These are some of the questions that can be asked to make the research EDI strategy more dynamic and open. Thank you so much.
Thank you. I'm going to ask Jill to kindly ask you for that in writing. I think I only caught the first few words. Sometimes I'm actually quite good at dictating, but I was too caught up in what you were saying to do it. But I think that's such a great ethos for all of us. I caught particularly the idea of, you know, how we do things for sort of the sake of methods, right? Or for the sake of what the grant's asking us to do sometimes. And I think about research as creativity and research as advocacy, and we have to start pushing back, right? For the sake, for the communities that we wish to serve, to really have a meaningful EDID and accessible research design. So Jill, my call to you is to please ask Asya to write something up there and have it in written form for those who can't watch this recording and who didn't catch those words, to have it written in a way, because I think that it transcends all the work that we're doing. So thank you for taking the time to share that important call to action with us.